Dear viewers, Eid Mubarak and welcome you all to our show OSA, that is Orthopedic Solution Academy. Hope you all are well with your friends, family, and patients. Dear viewers, today our topic is foot injuries treated by Ilizarov. It is a very complex injury, but we can make it easy by Ilizarov. And the speaker is the one and only, the legendary Ilizarov surgeon of Bangladesh, Professor Mofakhkharul Bari sir. I would like to request Professor Mofakhkharul Bari sir to join with us.
Good afternoon, everyone. Thank you very much, Tanvir.
Good afternoon, sir. Thank you very much for joining with us. Dear viewers, we have three learned academic experts with us. One of them is Professor Omer Barawi sir from Kurdistan. I would like to request Professor Omer sir to join with us.
Good afternoon, everyone. Happy Friday. Thank you so much for your kind
Good
effort.
afternoon, sir. Thank you very much, sir, for joining with us. We have another enthusiastic Ilizarov surgeon from Patna, India. I would like to request Dr. Shamsul Huda sir to join with us. Dr. Shamsul Huda sir, would you please join with us?
Good afternoon and happy to all of you.
Thank you very much, sir, for joining with us. Dear viewers, we have another academic expert from Kurgan, Russia, that is Professor Novikov, sir. Hope he will connect with us in the coming part of our program. Now, I would like to request our honorable speaker, Professor Mofakhkharul Bari, sir, to share his screen and start his presentation. Sir, would you please share your screen, sir?
So, thank you very much, Tanvir. And today, I'd like to talk on the foot injuries. These are the common slides that I love to show you all the time. So these are the common slides, my working place, and this is as usual Kurgan. So the end of the leg on which a person normally stands and walks, that is called foot. The foot is an extremely complex anatomic structure made up of 26 bones and 33 joints that must work together with 19 muscles and 107 ligaments to execute highly precise movements. The foot is comprised of bones including the phalanges, metatarsals, tarsals, and calcaneus, muscles that enable flexion and extension, ligaments that connect bone to bone, the tendons like the Achilles tendon that connect bone to muscles. So there are a variety of anatomical structures that make up the anatomy of the foot and ankle, including bones, joints, ligaments, muscles, tendons, and nerves. Here you can see in the picture. And if you think about the foot anatomy, it is divided into three sections: the forefoot, midfoot, and the hindfoot. There are bones, joints, muscles, tendons, and ligaments to each of these sections. If you look at the right side, you can see the hindfoot, you can see the midfoot, and what are the bones comprises of the hindfoot, midfoot, and the forefoot. The forefoot is the anterior aspect of the foot, composed of the 5 metatarsal bones, 14 phalanges, and associated soft tissue structures. Midfoot, this section of the foot is made up of 5 irregular shaped bones called the tarsal bones. They are named the navicular, cuboid, medial, intermediate, and lateral cuneiforms. And hindfoot enables the foot to make most of its sideways movements, consist of 3 joints which lie around and below the ankle, the subtalar, calcaneocuboid, and talonavicular joint. So before going to do any surgery, you must have complete idea regarding the forefoot, midfoot, and hindfoot. So these are you can see in the left side, human foot bones, and the right side, you can see the medial column of the foot, lateral column of the foot. So common foot injuries are sprains, strains, and ruptured tendon ligaments, bone fractures, tendinitis or tendon inflammation, osteoarthrosis or arthritis, wear and tear arthritis, you can tell, and at the same time, rheumatoid arthritis or autoimmune disease. Foot injury refers to injuries that most commonly occur during sports, exercise, or other physical activity. They can include strains, fractures, and dislocations. And injury to the foot can damage muscles, ligaments, tendons, and bones, resulting in significant pain, disability, and wearing of the joint, cartilage, that we can see in arthritic patient. Foot injuries include phalangeal fractures, fracture dislocations, fracture of the metatarsals, and tarsometatarsal joint injury that is called the Lisfranc joint. Midfoot injuries, severely comminuted displaced fractures of the navicular, cuneiform, the cuboid bones can cause significant disability. In these fractures, accurate reduction of the tarsal bone is essential. Hind foot, it takes a lot of force to fracture the bones in the hind foot. Injuries most frequently result from car crashes or falls from a significant height. Fractures may occur in the heel or the bone located at the top of the heel. Hindfoot fractures take a long time to heal with or without surgery. Now you can see here is the normal foot morphology here. You can see from lateral side, these are the angles that you can find here, dear friends. You can see from the left side, top two figures, the angles you can see the 25-degree in between, and that is the 28, 24, 5 degrees centigrade. And if you see in the cavus area, that is, we draw a line from the calcaneum to the first metatarsal, and that angle is 125 to 130 degree. So normal foot morphology, you should have to have clear idea regarding the normal foot morphology. Now again, you can see here, if you draw a line, the calcaneum, look at this from the lateral side and from the lateral side. These are the angles that you should have to keep it in your mind when you are going to do any surgery in the foot. So Ilizarov fixation of the foot, there are many drawbacks to using conventional approaches to the treatment of complex foot injuries, like the increased risk of neurovascular injury, soft tissue injury, and the shortening of the foot. In higher energy injuries and severe injuries to the soft tissue and underlying bone open reconstruction may not be possible. An alternative approach that can eliminate these problems is the Ilizarov method or technique. In such cases, Ilizarov fixation is used to stabilize the foot. This will maintain columnar bony alignment and allow soft tissue reconstruction. Now, an Ilizarov fixator is a stabilizing frame to hold the broken bones in proper position. You can see right side in the picture. You can see in the right side a half circle in the calcaneum and in the forefoot, the position of the bones and the rings. And in Ilizarov fixator, metal pins or screws are placed into the bone through small incisions in the skin and the muscles. The pins and screws are attached to a bar outside the skin. Now, what are the benefits of the Ilizarov fixation procedure? Key benefits of Ilizarov fixation include stable foot and ankle. You will get long-lasting pain relief, better mobility and function that you can provide, and you can get the improved quality of life. Tips to protect your foot. These are the very important things that we should have to remember. Avoid exercise or playing sports when tired or in pain. Warm up, do ankle stretches before playing sports or exercise. Watch steps when walk on cracked sidewalks or uneven surfaces. Run on a flat surface to minimize the chance that will twist and injure foot. Wear sensible shoes. Choose footwear that fits well and is suited to what you are doing and reach the toes. Wearing high heels is one of the biggest cause of ankle sprains among women. So, dear friends, now I would like to share some cases that we are facing day to day in our life. So, this is a lacerated injury of both foot and ankle, 6-year-old girl. Look at the left side and the situation in the x-ray of the middle and after doing the suture. And you see what we have done. You can treat this kind of injury by very simple way by putting a one ring and two posts and a half ring with two olives from the medial and the lateral sides. So this is after 5 months treatment. Now you can see here open Lisfranc joint dislocation, 55 years old male. You can see here in the right side the bone are exposed And as soon as patient comes to place, you can place 2 blocks in the distal tibia and half ring with hinges. And this is the situation that you can treat before and after. So this is a case of old, you can see a disfranc fracture dislocation of the left, 20 years old male. You can see in the middle and in the right side. And after treating the patient with Ilizarov fixation by 1 ring here and 2.5 rings there with connecting the hinges. And this is after treatment only in the follow-up after 3 months. You can see from the left side and you can compare the right to the left side. Now, this is a case of open Lisfranc joint injury or with first metatarsal bone with grade 2 of a 32 years old male patient. Look at the back side sole of the foot and look at the grade 2. And then sequentially, we have treated this. Look at the sole of the foot and the right side you can see here after treating treatment with Ilizarov, and we have put the small, cave wire in the phalanges. And from this situation to that situation after 6 months follow-up. And these are the beautiful cases that you can tackle, and difficult cases beautifully by Ilizarov apparatus. Look at this fracture of the talar bone that is related to the hind foot of the age 65 years. You can see here, these are the cases that you can go for other procedure also, but you can tackle these kinds of fracture of the talus or Blair operation. You can see here red marking you can see here, and Blair operation is the accepted method to achieve an ankle arthrodesis in the presence of a vascular necrosis or absence of the body of the talus. You can see the left side, and this is the follow-up after 3 months. 3 months. So calcaneal fracture, look at the right side, the length and width and breadth of the calcaneum before surgery, and this is open case. So these are the cases that you can beautifully correct by Ilizarov technique. See how I have done, what I have done. You can see 1 block in the lower tibia, and then in the calcaneum, just look at the middle picture. That is how reduce the calcaneum, and then this is the final follow-up after 3 months by treating the Ilizarov technique. Another case, you can see here first metatarsal dislocation for the cuneiform of the right foot. In the middle one you can see, and you can see the shape of the foot before surgery. And it was a old case, late case. So gradually you can distract and you can align the bone nicely through this Ilizarov technique. So look at this. Just look at the left side and look at the right side. This is the follow-up after 4 months. Now, osteolytic lesion, distal IP joint, grade 2. He was treated elsewhere. Look at this. And then it was a post-traumatic, and the patient came late to me. Then I put with mini Ilizarov fixator. And then finally you can see from before treatment to the left side, and this is after 2 months follow-up. And this is a very, infected gastilo 3B with uniaxial fixator. He was treated elsewhere. Look at the sole of the foot, and look at the back side, and look at the front side. These are the cases very difficult to salvage. But whenever you have Ilizarov in your hand and you know the technique and principles and philosophy, then you can solve this kind of gastro fractures by Ilizarov technique. Look at these, first day in OR, look at the situation in the right side, and sequentially we have started treating And look at this, the lengthening of the tibia, and at the same time, by putting the, Ilizarov telescopic rod and fixation of the calcaneum, and you can see the back side of the calcaneum, and front side, the left side, and the right side. Sometimes it is very difficult to understand what is happening in these kinds of wounds and with Ilizarov fixator. Now look at these, the left side and the middle one and the right one. And finally, we have taken the help of the plastic surgeon, and now you can see here the back of the leg and back of the calcaneum, and this is before, after final follow-up after 11 months. If you please, with the full hand and middle. So these are the complicated cases that you can treat by Ilizarov. Now, dear friend, you can see here avulsion of the right heel with fracture of the lower end of the tibia and fibula. You can see how avulsed the heel, and then we have gradually pulled that one. Patient was diabetic, and you can see the left side, and gradually we have pulled the avulsed, that calcaneum tendoachilis, and then gradually we achieve to, hello, and see, look at this. This is after 3 months follow-up, and before treatment, and look at this after 6 months follow-up. Again, deglobing injury of the right calcaneum. This is also related with the foot injuries, hind foot injury, right calcaneum you can see. Then what you have done, look at this, the left side, and gradually we have pulled the avulsed calcaneum, and then gradually pulled that one after 4 months follow-up. Look at the middle one, and then we have treated, and this is the front side and back side. So why Ilizarov? I always tell this kind of, this is very important for the young orthopedic or budding orthopedic surgeons. We are telling all the time what you can achieve by Ilizarov. Ilizarov feel any defect in life of both. That I have shown you. Then when you are hopeless, you can have treatment. You can go for treatment with this Ilizarov. You can think about the Ilizarov. Ilizarov can change the quality of life. And when all lights are off, the light of Ilizarov is on. And the end of the disability you can get by Ilizarov. Bright future is disability by Ilizarov. So that I have shown you, this is in 2019, we had a conference in our orthopedic center, Bari, Ilizarov in Dhaka. All the stalwarts, including our senior professor, Professor Shamsul Huda, and I myself with Shamsul, and we are conducting the conference, and Shamsul, he was my mentor, and still he's alive, and he's active, and doing a lot of cases, and he's doing a lot of cases, extending his hands in Kurgan and other parts of the Russia. So, and finally, dear friends, what I'd like to show you, that I have shown you, that is the evidence, science, and of course the surgical skill of the surgeon. I always love to show this one, and this is the carry-home message for everyone. Ilizarov is always related with biology, biological activities, and mechanical activities, and we can do any kinds of problems in the foot by Ilizarov technique. Thank you so much for your kind attention.
Thank you. Thank you very much, sir, for your excellent presentation. Professor Novikov, sir, has joined with us. Now, I'd like to request Professor Omer Barawi, sir, to say something regarding the presentation.
Thank you so much. Really, it's a very nice presentation. The thing which I want to say is that one of the principles of Ilizarov is preservation of blood supply. That's why the procedure will be successful. Not only reduction, hold, and exercise. More important than this is preservation of blood supply. So according to these cases and our experience also, we can say that there are some cases, this is absolute indication for Ilizarov. Without Ilizarov technique, it will be very difficult, good number of the cases, and it will be ended by amputation. Thank you so much.
Thank you very much, sir. Now, I would like to request Professor Novikov, sir, to say something regarding the presentation, though sir has joined the later part of our presentation. Professor Novikov, sir, would you please share your knowledge regarding the foot injuries and Ilizarov?
Thank you very much. Very sorry because in the Russia, Facebook is blocked, and just now I want to introduce my helper. We work for patient, and sometimes patient help us. Maybe in future I will introduce this guy. Just now we support him length and correct deformity of left humerus, but during the life he never use lower extremities because has severe deformity both of knee joint, hip joint, and just now he can change position only by wheelchair. And very sorry because only a few minutes ago I contact, but I agree with Professor Bari. So many difficulties, including problem of ankle joint, only for treatment of Ilizarov. During this week, we have not so many, but few cases, and all of them in operation theater. And after that, we have some, I cannot say complication. I need to say was difficulties. And magic of Ilizarov can us go away from dislocation, from severe problem, and with outside of bone, outside of an operation theater, we can make excellent reduction. And next week, Dr. Mirzamurodov from Uzbekistan, from Bukhara, will present this not strange, normal, absolutely normal routine situation with Ilizarov, because we cannot get excellent perfect result with difficulties. Like baby need time, and any baby go away from mama with difficulties and with pain, but after that happiness will come. And next week, this is our Friday, and I hope we will show possibilities of magic Ilizarov methods and then magic Ilizarov effect. Спасибо огромное.
Thank you.
Спасибо.
Thank you very much, sir. Thank you.
Сейчас на тебя весь мир смотрит. Да.
Hello.
Yeah.
Thank you very much, sir. Now, I'd like to request Dr. Shamsul Huda, sir, to share his knowledge regarding the foot injuries and Ilizarov.
Thank you, Dr. Tanvir. Thanks, Bari, sir, for a wonderful presentation, a variety of cases. Thanks, Novikov, sir, for the questions. In our setup, we get accident cases. We have very lacerated wound, big love wound where just the slab is not enough. We cannot apply plates. In these cases, applying just K-VAS makes the joint stiff, very stiff. And in all the foot injuries, because nowadays foot and ankle is a very specialized branch. Can you hear me? Am I audible?
Yes, sir. You are completely audible, sir. Please.
So now that we have another specialized branch in foot and ankle society. So foot is a very specialized branch. So in all the foot and traumas or non-illness, we have to take care that we just don't have to fix the fracture. We have to see that after fracture, the ankle alignment or the tarsal joints alignment is good. The foot arch is okay. The whole soft tissue is well maintained. So the whole foot mechanism has to be as near normal to before. Otherwise, we'll be having a deformity, a pain that the patient will suffer for life. So you have to be very, very specific in foot injuries. So here, Ilizarov has a very vital role. With Ilizarov, after fixation, we can with hinges we can do a very good movements, range of motion, partial weight bearing. So that is very, very important. Ilizarov here plays a very important. X-fix is just not enough. X-fix is an automated thing with foot injuries. So if you cannot apply foot plates or nails, don't just go for K-VAS or external fixators. Apply Ilizarov very well and get excellent results in this case. Thank you.
Thank you very much, sir, for sharing your knowledge. Sir, I have a question to you regarding the avulsion fracture of tendo Achilles and the calcaneum. Sir, how do you manage that thing by Ilizarov? Did you give any tension to the tendo Achilles, or did you fix the tendo Achilles in the later part of the treatment procedure?
Dermatogenesis, whenever your backside tendo Achilles region with the skin is avulsed, you just pull the multiple olive wires, from the backside, and gradually you can go for distraction, that is compression. And whenever you are looking that 2, 3, or 4 times, depending upon your gap, whenever you are confirmed that when you are applying compression, you are getting the dermatogenesis, skin lengthening, covering, then you can go for suturing. Very easily you can do that, just like the tissue genesis. You put the olive wires from the backside with the rubber stopper, and the backside is very thick, avulsion of the sole of the foot, and you can gradually pull, and later on, whenever your 2 ends are near, then you can go for suturing. This is very simple case, but tissue genesis, that is called the dermatogenesis or tissue genesis. Okay.
Yes, sir. Sir, we are facing lots of road traffic accident in your countries, and we are having that type of patients that they have lost their skin of their sole. Sometimes we have to take the help of the plastic surgeon to make flaps to cover that heel. Do you have any experience of dermatogenesis to cover up the heel without taking help from the plastic surgeon?
No, that I have shown you that without taking the help of the plastic surgeon, that your sole is avulsed, and if you see as soon as sole is avulsed and the circulation of the sole is okay, then you can go for distraction. That is the compression of the skin, sole of the foot. And whenever, as soon as you are giving the compression, that means you are going on distraction from the backside with putting one ring in the lower end of the tibia. As soon as you are giving compression or distraction, you will see the sole of the foot, it will come end to end. Then you can go for suturing. And sometimes it happens your full sole is damaged, then you should have to, if you don't have any sole, you should take help from the plastic surgeon. If you have sole is there, sole is viable, then you can go for by Ilizarov technique. Okay?
Okay, that's great. Thank you very much, sir, for sharing your valuable knowledge with us. This is all about today. I would like to thank OrthoTV and definitely Malia CNT Specialized Hospital for helping us to arrange this type of academic program. I'm Dr. Tanvir Ashraf saying bye-bye today. Hope we'll connect with you in the coming Friday with another magical topic. Till then, I would like to say bye-bye to all of you. Bye-bye.
Thank you very much.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.